First of all, the decision to partner with you guys was the best decision I've made. And I had to take a long look during COVID and realize that I may be a good orthodontist, but I am not a social media person. I am not a business person. I don't have an MBA and I need help. So thankfully I came across the webinar with Brian and it's been the best thing I've ever done. Takes a lot off me as the doctor. Fresh ideas and everything all in one place. It's like my dream. And my staff, I'm lucky they didn't bucket because maybe we had done things a lot of, it was just new. So it was a little bit of an adjustment, but now what's so awesome, and Brian should be happy, they're all critiquing when they go places. So now they're like, wow, horrible customer service there. The person on the phone didn't even say hi and put me on hold. So it's like amazing, and it makes it more fun. And the atmosphere when people are happy and positive, it's just infectious.
Hi there, Brian Wright, founder and CEO of New Patient Group, host New Patient Group Podcast. Welcome into our video production room and podcast studio. And that was a great words from Dr. Ashley Reynolds, orthodontist, has been with us quite a while. A lot of great success with her. This next gentleman is one of my best friends. Been with us for many years. One of the things I love most about this company is the relationships. This is not the typical consultant, see you for a while, goodbye. Our family here is a close-knit group, clinically, non-clinically. There's so many cool things that help our clinicians become a better business owner. Teams learn the skill sets that they do every day that are non-clinical, that they receive in most practices little to no training on. The digital marketing, online marketing piece, those are all the services, but it goes so far beyond that. It's the relationships and the consistency and the accountability to actually take all of this great stuff that you're working on, whether it be our ideas or yours, and actually effectively implement them. We are that partner, that business partner, an executive level team, if you will, an entire team of baseball coaches, if you will, that is there with you through the hard times, through the good times, to make sure you have a shoulder to cry on, to make sure we are always moving the needle forward. And that's so critical because that's left out of consultant programs. Relationships, we are so close to our clients. Like I said, this next gentleman, one of my best friends, and let's take a listen now to Dr. Bob Skopak and what he has to say.
This is such a cool group because we all care about our patients, we all care about our team, but we also want to have a low stress, smooth running, profitable business. Now, it's a fairly unique combination when you can get continuing education or input on all of those things. I think we have such a unique, exciting group here where we can get input on all those things. We have some phenomenal clinicians in this group. We have people that aren't afraid to share information, aren't afraid to have a differing view, and that's great. Doesn't matter what brand we use, doesn't matter what technique we use. It matters that we want the best clinical treatment and we care about our patients and our team. And we just happen to have this great business mind, Brian, sitting in the room with us, that can listen to what we're saying, and think about what we're saying, and actually get us to use that in a business and get us to be successful in our business doing that. I think it's a very unique combination. I'm not sure it exists anywhere else.
Well, I can say for sure, now Dr. Skopak said he doesn't think this exists anywhere else. I can say for sure that this does not exist anywhere else under one roof. This is the single most powerful, most unique program ever created, and it's designed specifically for this new economy where the better business is unfortunately defeating the better clinician. There's a lot of examples, a lot of reasons why. One, I'll just give you a quick one. You call somewhere and the receptionist answers and she knocks it out of the park. She has the skill sets, or he has the skill sets that are so high level, so Ritz-Carlton, so five-star resort-like that you leave that call going, wow, I'm buying from that place. That's an example. Meanwhile, that place has the worst clinician in the United States. Then caller calls a practice and you're the best clinician in the United States and your receptionist completely blows it. Here's the thing, in this new economy, what you have to understand is the consumers relate to the non-clinical experiences. And there's plenty of psychological studies about this, that the less a consumer understands your business, your skill sets, such as clinical abilities, the more your non-service related sale, the more those experiences matter. And inside a clinical environment, from the time they're shopping to the time they call and all these other touch points that your team does every day, the reality of the situation is they are critical to your success. Your culture is critical to your success because without the culture, the training you invest in your team is going to go right down the toilet. Digital marketing, online marketing, you could be the best in the business, but if your culture does not support the right content to be shot, if your culture does not support the training, you're going to get all the calls in the world, but you're going to lose opportunities. That is the reason why this program is created, is it controls the 3 biggest keys to your success for the rest of your life is its culture, training, online marketing. You nail those things, you will never spend another nickel in your entire life. So Dr. Skopak said it really well. In addition with this program, it's also clinical because inside my mastermind group, our mastermind group, you have some of the finest clinicians in the world discussing high-level stuff. It's absolutely wonderful to see. We meet every month. We see each other every year at our virtual event in that mastermind. And here's another really great story. This one's from Dr. Ann Haggart. And then after that, you're going to see the great Dr. Boyd Whitlock and a lot of other testimonials as well. And looking forward to welcoming you into our family. I know we can do a lot for you, and we'll talk to you soon. Bye-bye.
Knowing that I wanted not just a consulting company, but that someone would be there on a regular basis to see through the things that we've implemented. I think that's the biggest problem. So New Patient Group, what have they done for me? I've been with them for 3 years now, and after the first year we grew 30%, and after the second year we grew another 30%. That speaks volumes, especially after my father retired. We had a 2-doctor practice, and he started to slow down, and here I was trying to take this over myself, and I didn't think I was going to be able to handle it, but they gave us the tools to train the staff and also train the patients on how things are going to be in our practice, and it has been extremely efficient.
Dr. Whitlock here this morning. I just wanted to leave or share a couple of notes about working with New Patient Group. They've been really phenomenal on helping us change our culture. Didn't even know we needed a culture change, but they were really good about helping us do that. A lot of that is by helping us recognize and reward some of our team members, and so that's been really awesome. But one of the other things is training, and I've had other consultants in the office in the past. One of the big differences that I noticed or that we've experienced with New Patient Group is the follow-up. There's a plan. They're a partnership with us. It's not a come in from one day and give us some ideas and tell us what to do. We have a step-by-step process that come in, and then we role play. Really practice role playing. And we've talked about role playing in the past with the other consultants, but then it was up to us to do that, and it never really happened. So really appreciate what we've seen and the growth we've already had, and look forward to many other times to come. Thanks, guys.
I have to admit, initially I was a little bit nervous to get started. It's admitting some of your faults that are sometimes not comfortable to do, but overall it's been a very easy experience. The transition from kind of me having full control over things to allowing somebody to come in and help me with the day-to-day activities has been just very helpful. Not only have we seen cohesion and team unity in the office improve, we've also seen a lot of growth with our new patients. A couple months we jumped up over, doubled our normal mark, which is amazing to see double the new patients that we had before, and we're planning a big remodel because of all the growth. I was at a seminar about 2 to 3 weeks ago, a big seminar, big national meeting, and there was somebody there speaking about Google, YouTube, how to place yourself on the platform, how to maximize your performance with search engine optimization, and New Patient Group nailed every single one of them. Actually, they're ahead of the curve. Hands down, recommend New Patient Group just because of this sheer growth and this sheer confidence building that I have as a doctor now.
We've upped our game, big time, big time.